That's not all. 6 health workers have died from coronavirus in China and more than 1,700 have been infected with the virus. China's National Health Commission has revealed that the number of health officials being infected by the virus has been increasing amid shortage of masks and protective suits. The risk to the health professionals treating scores of patients with COVID-19 was revealed in a press conference today. This figure comes a week after public anger erupted over the death of a whistle-blowing doctor who had been reprimanded and silenced by police after raising the alarm about the virus in December. China's National Health Commission Vice Minister Zheng Yixin said at a press conference about protecting medical workers. He also said that the number of infected medical staff is increasing. Listen in to what he said.
Measures should be taken to strengthen the protection facilities and equipment for the medical staff who are exposed to the virus in their professions. With emphasis on renovating doctors' offices, efforts must be made to offer better logistical support for healthcare workers.
Chinese officials and hospitals have repeatedly noted a shortage of protective equipment, including face masks, as the disease takes hold in Hubei and spreads throughout the country. Chinese healthcare and social insurance authorities have pledged enhanced efforts to protect medical personnel at the front line of the ongoing fight against the novel coronavirus outbreak in the country. The 1,716 healthcare professionals who have been diagnosed with COVID-19 account for 3.8% of all confirmed cases across the nation.
The medical staff should be given reasonable schedules to work and rest. We must enhance their personal protection by organizing health checkups for frontline medical workers and minimizing hospital-acquired infection. Psychological intervention and counseling should be improved to ease their mental stress.
Among the infected medical workers, 87.5% or 1,502 are in the hardest hit central province of Hubei, including 1,102 in the city of Wuhan, which is at the center of the viral pneumonia outbreak since mid-December. While highlighting proper rest and strengthened individual protection, the Health Commission said psychological intervention and counselling are necessary to reduce the psychological pressure of the medical personnel engaged in the fight against the highly contagious coronavirus. The official said the payment of allowances for medical workers should be guaranteed. The circular called for improved humanistic care and a safer working environment for medical staff, as well as greater publicity for the merits of outstanding medical personnel by the end of Thursday. The virus has infected more than 63,000 and claimed over 1,300 lives. Meanwhile, hundreds of medical staff in Wuhan shaved their heads to reduce the risk of contagion. 3 hairdressers volunteered to give haircuts for free in a hotel, which hosts medical teams that came from other provinces to support hospitals in Wuhan.
Their
requests were very simple. They wanted to cut the hair as short as possible because they need to wear a protective hat and can't expose their hair. Many little brothers and little sisters told me directly to shave their heads. Normally, out of 100 customers, I probably wouldn't have even one request. At most one, I suppose. But in these 2 days, I've already shaved many heads. Every time before I do it, I would double check with them whether they really wanted to shave. I think I really admire them. They sacrifice themselves during this epidemic period.
Many of the medical staff made the decision to cut their hair short or remove their hair altogether, including 30 female medical staff who even took the bold step to go completely bald.